Chief complaint, patient was brought into the ER by family with complaints of shortness of breath, decreased appetite, body aches, abdominal cramping for the last couple of days. History of present illness. The patient is a pleasant 48-year-old female who unfortunately has a past medical history of advanced breast cancer with metastases to the lungs and liver. She was recently discharged from the hospital where she received chemotherapy. Last one was approximately 4 days ago. She came to the hospital today because she was having cough, shortness of breath, feeling like she had to be in a sitting up position in order to breathe, difficulty swallowing with sensation of choking. In the ER, she was found to be tachycardic and mildly hypoxic. Review of systems, 12-point review of systems was completed. Beside the information in the history of present illness, everything else is unremarkable. Problem list, past medical history, ongoing breast cancer, hypokalemia, mixed hyperlipidemia. She is pre-diabetic. Historical, no qualifying data. Advanced directives, she has none. Procedure and past surgical history. She had a portacath placement this year to the left upper chest, an axillary lymph node dissection as well, excision of the right axillary lymphatic system, chemotherapy. Medications here in patient really only for pain. She is on the acetaminophen hydrocodone 325 10. She is on Lovenox, hydromorphone, and PRN lactulose, as well as Protonix, pantoprazole, 40 milligrams daily. Home medications include tramadol only for pain. Allergies, she has no known allergies. Social history, occasional alcohol drink. She says she drinks a beer or two, maybe 2 to 4 times a month. She is currently unemployed. She lives with her children and her spouse in a home. She is on a regular diet at home with no food preference. She says normally she has a good appetite, and she feeds herself. She is independent in that aspect. Substance abuse. She does admit to smoking marijuana occasionally, maybe once or twice a month. Tobacco. She is a former smoker. Used to smoke approximately 3 cigarettes a day. Started at the age of 16, ending at 47. Which was about 1 year ago. Family history, father had a heart attack and passed away. Mother has hypertension. Chest x-ray diagnostic results with a known history of breast malignancy and stable mediastinal and parenchymal metastatic disease. She has interval worsening of the central venous congestion and interstitial pulmonary edema, as well as bilateral small pleural effusions. Physical examination, vitals and measurements. She is 36.9 degrees Celsius, heart rate 120, respirations are 18, blood pressure is 154/69. SpO2 96% on room air. She's 149 centimeters and 48 kilograms in weight. General, no acute distress. Her eye, she is pearl with normal conjunctiva, normal cephalic, clear tympanic membranes, normal hearing, moist oral mucosa, no sclerolicterus, and no sinus tenderness. Mild JVD is noted. Her lung sounds, decreased respiratory sounds in the basis. She is tachypnic and with asymmetric crackles. Her heart, like I said, tachycardic, distant cardiac sounds noted, +1 edema to the lower extremities bilaterally. Her abdomen is soft and non-tender, non-distended, normal bowel sounds, no masses, normal range of motion, no tenderness or swelling. Skin, warm and dry, no rashes or lesions. Neurologic, awake, alert, and oriented ×3. Cranial nerves 2 to 12 are intact. Genital urinary, no hematuria. Psychiatric, she is cooperative and appropriate mood and affect. Pertinent lab results, her WBCs are low at 3.86, H&H low at 9.2 and 29.5, sodium low at 132, potassium 3.3, chloride is at 86, CO2 is high at 37, BUN and creatinine 22 and 0.5, calcium is high at 11.2, albumin 2.9, low, and protein serum is low at 6.2. Her AG ratio is 0.9. Assessment and plan for this young lady. Number one, shortness of breath could be multifactorial. Her saturation is above 90% all the time, even on room air. She's been given a diuretic, but her breathing has not improved much, or her shortness of breath, rather. We're going to continue with current therapy. We will probably consult IR for a thoracentesis, see if that will help with her shortness of breath. But the shortness of breath probably is due to her metastatic disease. Chest X-ray has shown interstitial pulmonary edema and central venous congestion, as well as small pleural effusions. Number two, dysphagia. Everything that the patient tried to swallow has had a sensation of choking and wondering if she may have metastatic lesions or something else could be going on. We're going to consult a GI, possibly get an EGD or a swallow evaluation, speech evaluation. Number three, metastases, and we're going to consult her oncology team for that. Thank you.